Not all chiropractors are created equal. That's a bold statement to lead with, I know, man. We are the only chiropractic practice in the area doing MOP. Well, MOP stands for Movement Ownership Program. And then we're the only ones because we literally came up with that program. After endless hours of treating patients and listening to their concerns and always kind of falling short with our treatments in the previous times, I just knew there was more that we could give to solve the problem that people are coming in with. And most chiropractors, to be honest, they are talking about treating the nervous system first. And, for most part, it's true. However, when us chiropractors often talk about treating the nervous system, we talk about the pressures on the nervous system that's causing dysfunction called subluxation, which is a great start. But most of us, kind of stop there. And, we could do better. I believe that, that's only, 1/3 of what we should be doing. With our movement ownership program, we identify the pitfalls of and coming short of conventional chiropractic care. So what we have done is that we figured out, after endless hours of searching and training, educating ourselves, that there was a better system and better techniques to literally interview your nervous system and ask direct questions on why, even without any trauma recently, is causing body pain and discomfort and causing your body to create compensations over and over again. I believe that we have some answers, much more than we had before. And, it's always going to be, work in progress. As long as I practice, we will never know everything, but we're always going to continuously pursue to get better every day. And the reason why we switched lanes, our focus as of 2 years ago is because of that. I realized there was so much more that we weren't doing for our patients when they came in within the scope of our practice. Your nervous system, without any trauma, recent trauma, will cause pain and discomfort due to need for compensation to restore sense of safety, within your body from perceived threats. Now, those perceived threats could be real, or they just could be perceptions after you have had some kind of trauma in the past, and your brain constantly plays that scenario as if your body is still going through that process. For most of us, if we have like a broken bone or torn muscle or ligament, most of it should be taken care of, structurally speaking, within about 12 weeks, and I'm being generous. Even after that, people are still experiencing pain and discomfort and dysfunctions. And, when we were treating people before, we always felt like there was more that we could do because we weren't getting to the extent of results that we were hoping for. And we were just kind of at a loss. And we just kind of chalked it up to maybe this person, is just a difficult case and this and that. But as time went on, that just became the norm. And I just got so sick and tired of putting up with that and then making that our standard. So I knew we had to raise our standards. And I believe that the standard in our industry right now is pretty darn low because it's easy. And it's just easy to do. It's just simple to do. Just kind of, coasting through, playing the insurance game and just getting paid for a little bit of what we do and all that kind of stuff. And, it's time to snap out of it. It's time to raise our standards in the industry, and we need to provide better services because our patients deserve better. And here at Rosenberg Chiropractic, that's a guarantee that we'll always make, is that we are always working to pursue excellence, to raise our standards, to provide the latest evidence-based, scientific-based treatment protocols and programs. Some treatments and therapies and techniques that we use are not even from chiropractic. We are always looking for different ways and different philosophies to figure out how can we put them together to make the best program for our patients to serve them the best. So with our program, you get answers to the questions of why has my body not been responding after years and years of chiropractic physical therapy, exercising and stretching. And I'm here to tell you, we found the reason why. And that's because you are not addressing the right issue, even though you may be addressing the symptoms and maybe some of the causes, but really deep rooted in is the problem is the nervous system just don't feel safe with your current situation. And we have to ask direct questions why. And we have a system to do that, exactly that. So we don't beat around the bush anymore. We don't have to guess as much like we used to. And we get to the answer, and we have the means to execute on the answer that we have found, to address it properly so that it doesn't become a problem, down the line. It's time for you to get answers that you deserve to feel like yourself again. And here at World Sports Chiropractic, I believe that what we do here is unique and is one of a kind that nobody else is doing in the world. I'm very confident in our abilities to figure out what problems you have and how to solve that problem. As long as you're not coming in with recent trauma, such as broken bones and torn muscles and all those different things, your body is constantly going through in the initial phase of healing, I believe we have answers for you. That's why we believe that we are best suited to help you in those type of situations when you have been trying everything and not really getting the answers that you feel like you deserve to get. So here at World Sports Chiropractic, we work on your movement ownership program, and it's your movement, so own it.